Hello folks, this is a 5-minute review about extraocular extension in patients with uveal melanoma. About this condition, about 10 to 15% of enucleated eyes show some extraocular extension of uveal melanoma. The mean age of the patients with extraocular extension is 60 to 65 years old. Extraocular extension may occur both with choroidal or ciliary body melanoma. Average thickness of patients with extraocular extension is about 8 millimeters. Physicians must have a high yield of suspicion because sometimes extraocular extension is detected after therapy during follow-up. What are the main risk factors? Size of the tumor, epithelioid cells, anterior tumor extension, and in the genetics, monosomy of the chromosome 3 or high mitotic activity. It's important to notice that extraocular extension may occur through any type of pathway, perivascular, directly, perineural, or through Schlemm's canal. Diagnosis of extraocular extension may be done with P-scan, with MRI, with anterior segment exam, and finally, it should be documented with histopathology. The management of the plan. Patients with uveal melanoma and extraocular extension have a worse survival. About 25 to 50% of the patients experience death. Enucleation is usually performed. Systemic workup should be pursued, and these patients may be considered to undergo systemic radiotherapy or chemotherapy with ipilimumab or nivolumab. So I reviewed the main highlights of extraocular extension of uveal melanoma. On the right side of the screen, you may appreciate two images of the same patient. On top, the hypoechogenic area behind a regressed uveal melanoma after plaque radiotherapy. At the bottom, you may appreciate the MRI scan of the large extraocular extension. I hope you enjoyed this little summary about extraocular extension. See you in the next video.